Hi everyone, my name is Jeremy, and today I'll be discussing the topic of obsessive compulsive disorder. Obsessive compulsive disorder, also known as OCD, is a type of anxiety disorder that comprises of both obsessions and compulsions. Obsessions are the recurrent, unwanted, and anxiety-producing thoughts or ideas that leads the individual to have urges to act on his or her compulsions. Compulsions, are also known as rituals, are the behaviors that may be repeated over and over again by the individual to reduce the anxiety that they are feeling. The individual is in a constant loop of having obsessive thoughts, leading to them feeling anxiety, leading to them performing this specific behavior, which then gives them a sense of relief temporarily until the thoughts come again. These thoughts and behaviors become so excessive that it disrupts a person's daily life. Keep in mind that they only have a brief relief from performing these behaviors. They may also spend lots of time having these thoughts and behaviors that it causes significant problems in their lives. The symptoms may last more than an hour each day, which shows how much it affects their lives. Some examples of symptoms of OCD are as follows. They may have an extreme fear of contamination, which leads them to spend lots of time washing their hands or cleaning surfaces. They may doubt themselves with doing things correctly, which leads them to constantly check if their stove is off or if their door is locked. They may have this excessive need for symmetry and order, which makes them want to arrange things in a specific way and in that way only. They may have superstitions that makes them have this need to count up to a certain number or in a specific pattern, or they may repeat words X amount of times because they may think that something terrible will happen if they don't perform the behavior that way. They may also have a fear of harm or losing control, so they may excessively check in on their loved ones. Some of the risk factors are having a first-degree relative that has OCD, having brain structural differences within their frontal cortex and subcortical areas, and having experienced stressful or traumatic events. There is no way to prevent a person from developing OCD, but complications may arise if OCD isn't caught early on or if it isn't caught at all. For instance, they may lose a chunk of their time from doing these compulsions. They may have a hard time showing up to work, school, or other social events. They may have health problems such as contact dermatitis from washing their hands constantly. They may have issues with their relationships, and they may also have suicidal thoughts. Unfortunately, there's no cure for OCD, but there are treatments available to ease the symptoms and help the individual. Treatments can be antidepressants, exposure and response prevention therapy, and deep brain stimulation. Exposure and response prevention is when the person is gradually exposed to the feared object or obsession. It allows the individual to discover ways and how to prevent themselves from performing their compulsions. If medications and therapy do not work, deep brain stimulation gives out electrical impulses to the brain through the use of electrodes. According to BeyondOCD.org, 1 in 40 adults and 1 in 100 children in the United States have obsessive compulsive disorder, and according to the National Institute of Mental Health, the lifetime prevalence among adults in the United States is 2.3%. This disorder affects everyone: men, women, children, different ethnicities, all types of backgrounds. Due to the fact that many years ago the disorder of obsessive compulsive disorder was unknown, the rate of it before was lower than it is now. The amount of cases of people with OCD before was most likely underreported, but now since people are gaining more knowledge about this disorder and are being diagnosed more, it may seem like the rates are increasing. And here are some of the resources available, such as the National Alliance on Mental Illness, National Institute of Mental Health, and the LA County Department of Mental Health. And here are my references.